Hello, and thank you all for joining us today. My name is Mia Cifuentes. Today we're going to talk about sexual health and staying active. Before we start, we want to let everyone know that this is an all-inclusive space. The topics we'll discuss apply to all individuals, regardless of their sexual orientation, gender expression, or gender identity. We're going to talk about the following: age-related changes that affect sexual health, staying sexually active. Last, we'll talk about practicing safe sex. Let's start with a quick trivia game as an icebreaker. Think of a 4-letter word that ends with the letter K that has to do with sex. The answer is talk. The most important part of a healthy sex life is communication. Sex can be enjoyable at any age. As we age, men and women may experience changes in their bodies that may impact many aspects of sexuality. But this doesn't mean not having sex. There are ways to adapt and stay active. A study of people 65 to 80 years old showed 40% were sexually active. 43% of these women said that they were satisfied with their sex lives. 50% said sex was important to their quality of life. This and other studies show that both men and women want to continue to having sex at their age. In this section, we're going to talk about some of the physical changes that happen as we age. What are some of the physical changes men experience that may impact sexual activity? Changes that happen include a decrease in testosterone, changes in sexual response like numbness, and erectile dysfunction, when the penis doesn't function like it should. This can include taking longer to get an erection and not getting one, not being as firm, lasting a short time, taking longer to ejaculate. Erectile dysfunction is common, but not every man gets it. It affects about 60% of men over 60. Treatment is available. You can discuss this with your primary care provider. What are some of the physical changes women experience that may impact sexual activity? After menopause, there is a decrease in estrogen and testosterone levels. The decrease in estrogen also causes thinning of the vaginal walls and less vaginal lubrication. These can make sex more painful. It may take longer to have an orgasm. Both men's and women's sex drives, aka libido, may decrease. This is normal and doesn't mean your desire goes away completely. You'll just need more time to get aroused. Reasons for this decrease include decrease in testosterone, chronic conditions like depression, heart disease, and diabetes, physical conditions like mobility issues, stress and fatigue, urinary tract issues, and certain medications, even though they may affect your sex drive. It's important that you do not stop taking your medications. Heart disease can lead to narrowed and hardened arteries that do not allow blood to flow normally. This can lead to difficulty with orgasms for both men and women, and ED for men. If someone has a heart attack, they may worry that sexual activity may lead to another heart attack. Older adults should speak with their healthcare provider for specific guidance for healthy sexual activity. Any shortness of breath or chest pain should always be immediately reported to your physician or nurse practitioner. Diabetes can contribute to physical changes that can decrease libido. Diabetes can lead to erectile dysfunction due to limited blood flow and nerve and blood vessel damage. Diabetes can cause vaginal dryness because of the damage to blood vessels. The decreased lubrication can cause sex to be painful. Yeast infections, which cause vaginal, vulvar, itching, and discomfort, are more frequent in women with diabetes. Oral and/or vaginal medication treatment is available over the counter and through your provider. Treatments are available, so speak to your healthcare provider for more information. Chronic illnesses also cause sexual problems or reduce interest in sex. Arthritis can cause sexual activity to be painful because of the joint discomfort associated with chronic illnesses. Here are some ways you can relieve pain: exercise, increase movement, warm or cool treatments, having sex at different times of the day when arthritic pain is less. A decrease in desire and other sexual issues can also be related to side effects from medications. For example, medications for blood pressure medications, antidepressants, seizure medications, chemotherapy drugs. Not everyone experiences all of these changes. Each person is different. What is important is to have the information you need to understand these changes and to address what's important to you. Discuss these things with your partner openly and honestly. Based on what we have talked about so far, what are some things that you can try to do with your partner to enhance your sexual experience? With the age-related changes we discussed, being more intimate with your partner helps with finding ways to make things work for both of you. Talk with your partner. Share your feelings. Understand that both of you are going through changes. Explore more kissing, touching, and masturbation. Have open discussions with your healthcare providers about issues and effective treatments. Remember, sex is both emotional and physical. If your healthcare provider doesn't bring up this topic, you should. They may be able to help with issues and effective treatments. Now, let's talk about ways that we can spend time on making sure that both partners are aroused. Spend a little more time on foreplay. It can set you up to be more responsive, interested, and excited about sex. There are sex toys that can help with stimulation. Applying a lubricant can make a wonderful addition to foreplay. There are also vaginal moisturizers that can increase wetness and vaginal elasticity. There are different types of lubricants and moisturizers you and your partner can try. Silicone, water-based, hybrid, vaginal moisturizers. Silicone lubricants are best for sensitive genitals. They're also recommended for penetrative sex and are compatible with condoms. These lubricants last longer than water-based lubricants. Silicone lubricants should not be used with silicone toys. Water-based lubricants are compatible with latex condoms. They also work with all sex toys, including silicone. These lubricants dry quickly, so you may need to apply multiple times. Note that there are higher risks for irritation and possible infection with water-based lubricants. Hybrid lubricants are a blend of water-based and silicone. These lubricants are safe to use with condoms. They are usually compatible with silicone sex toys, but read the label to be sure. Hybrid lubricants last longer than water-based lubricants and are more likely to stay slick. Vaginal moisturizers can be helpful. These are a great option for women who are experiencing ongoing discomfort due to vaginal dryness or are experiencing painful intercourse. Unlike a vaginal lubricant, a vaginal moisturizer can be applied regularly and at least 2 hours prior to sex, rather than right before as you should with a lubricant. A vaginal moisturizer aims to replenish vaginal moisture and relieve ongoing discomfort experienced with vaginal dryness. If you are on a course of medication that must be inserted vaginally or rectally, check with your healthcare provider before engaging in penetrative vaginal or rectal sexual activity. Using any vaginal rectal lubricant. Safe sex means things that you and your partner do to prevent sexually transmitted infections to keep you safe. It means using lubricants to decrease the risk of genital tearing and using protective barriers. This also includes getting to know your partner and their sexual history. STIs are still a risk for older adults. According to the CDC, the rate of STIs for those 55 and older doubled between 2014 and 2018. In 2018, over 50% of adults with HIV were over 50. Older adults are more vulnerable to getting STIs. Some of these reasons for these are: a decreased immune response increases the chances of infection. There are low rates of condom use. Symptoms of STIs can be more difficult to recognize or confuse with normal signs of aging like aches and pains. There are very few STI prevention efforts directed toward older adults. Even providers may think older adults are not at risk for any STIs, which is not true. Older women are at increased risk for STIs. Thinner vaginal walls can lead to tearing and therefore an increased risk of infection. There are several ways to decrease your chances of getting an STI. Always make sure to use a protective barrier when you have oral, vaginal, or anal sex, or any type of sexual activity that involves the exchange of body fluids. For example, using condoms for vaginal or anal sex and dental dams for oral sex. Always use a protective barrier when sharing sex toys. And make sure to properly disinfect sex toys before sharing with your partner and before and after use. This guidance applies for heterosexual, same-sex, and transgender couples. Both male and female condoms can be bought in stores. You can always get them for free at certain locations with a family planning clinic or community-based organization. Make sure you use a new condom for each activity. Check the expiration date. Do not use the product if it has expired. Make sure they're stored in cool and a dry place. Do not use female and male condoms at the same time. Dental dams are a rectangular sheet of latex or vinyl material that can be purchased online and in some stores. Dental dams are latex or polyethylene sheets. They are used for oral sex. Use a new dental dam every time you have oral sex. Only use water-based, silicone, or hybrid lubricants to prevent breakage. Finger cots are latex covers that go on the finger. For sex, that involves the insertion of fingers. They can be purchased online or in drugstores. Remember that a decrease in desire may just mean that you need to find new ways to keep your sex life fun and exciting. While sex might take a little more effort and commitment from both of you, that doesn't mean it will be any less pleasurable. Making sex a priority will help you and your partner close and connected. Deal with any problems or challenges as they arise. Make sure to communicate. You can find new ways to keep things fun and exciting, including toys and lubricants. And remember to practice safely to protect against STIs. Thank you everyone for your time today.